You're listening to the Doc Lounge podcast. This is a place for candid conversations with healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment. I am your host, Summer Gilbert, and I am the Director of Marketing and Branding here at Pacific Companies. And for this episode, my co-host is Pacific Companies COO, John Polk. Thanks for joining me today, John.
Great to be here with you again, Summer.
Back at you, John. Today, I am excited for our listeners because John and I talked to Dr. Jason Yaun, board-certified pediatrician out of Tennessee. Currently, he's an Associate Professor of Pediatrics at the University of Tennessee Health Science Center. He is a medical director for the Family Resilience Initiative. He's a division chief of outpatient pediatrics, a clinical director, assistant program director for the pediatric residency program. So he is one busy guy, to say the least. On this episode, Dr. Yaun talks to John and I about why he got into medicine, why he picked pediatrics, and he has amazing advice for med students thinking about going into pediatric medicine. So listeners, hang on really quickly after this quick disclaimer for our episode with Dr. Jason Yaun. And just a quick reminder, this podcast is intended to be an open forum. Any personal beliefs, views, or opinions represented in this episode are that of our guest and do not necessarily reflect the opinions of Pacific Companies. So please have an open mind and remember that this podcast is not a news source, but rather a safe and neutral platform for candid conversations. All right. Well, thank you so much for taking your time today to chat with us. We really appreciate it.
Sure, of course. Happy to be here.
Let's start from the beginning. What made you want to go into medicine?
Sure. I don't think I had a typical pathway in some ways, but I think in some ways probably a fairly typical pathway. It was really my encounters with the medical system as a child, a young adult that drew me into the medical field. I grew up in a home where nobody was directly in the medical field. My father was in government administration. My mother did actually work as an executive assistant for a psychiatrist who was in academic medicine. He was mostly a researcher in addiction science. So she did encourage me and push me towards the medical field, but I was not really interested going through school. Science was definitely not my strong suit. So I was all set to go into a career in business. But my senior year in high school, I was 18 years old, had just turned 18, and felt a lump in my testicle. And was actually diagnosed with testicular cancer, had a couple surgeries, and then had a few months of chemotherapy. So it was really my involvement with the medical system and the physicians that I became involved with, particularly my urologist, Dr. Lynn Conrad, here in Memphis, and my oncologist, Dr. Meg Gore, also here in Memphis. Just seeing their compassion and their drive and everything that they did for me really got me thinking about medicine. I still put it off for a couple more years. It wasn't until my junior year in college that I finally decided to take that plunge and go for it. So it took a little while for me to come around, but really that's what pushed me into medicine in the first place.
We are fortunate to have you among the ranks of primary care pediatricians. That's terrific. Do you have a subspecialty interest, something that piques your interest more, perhaps pediatric oncology or something along those lines?
Well, I did. I initially thought, that I would be going into medical school. I thought that I would be a urologist or an oncologist and go into one of those fields. And I really did look pretty deeply into urology, but I'm just not that good with my hands, and surgery just wasn't a very natural fit for me. So as much as I love the field of urology, it just wasn't for me. So once I ruled that out, I started to realize I really kind of liked everything. So I was a little bit unsure what to go into at first. I actually initially went into a matched program of internal medicine in a pediatrics program, so a combined program. And what drove me into that was really just once I started doing my pediatrics rotation, just the incredible physicians I got to work with, the educators, and then of course being with the children and parents. Everyone was happy, and it was just kind of a different breed of physician and staff and people to work with. So that's what really pushed me into the pediatrics field. And I'm a general pediatrician. I did think about doing a fellowship in pediatric oncology, but really just have a passion for primary care, for advocacy in the pediatric realm. Of course, in Memphis, we are fortunate enough to have St. Jude here, St. Jude Children's Research Hospital. So I was able, through part of my training, medical school and residency, able to work there and see some and be a small part of some of the incredible work that they do. But in the end, just felt like general pediatrics and primary care was the right place for me to be.
Thank you for sharing all of that. A lot of our listeners are people considering a path in medicine and which one to take. And certainly, they're coming out of medical school, and there's a lot of draw one way or the other. What does it take to be a successful pediatrician?
Well, I do think it takes the ability to be able to navigate a lot of different situations. I think working with children is a little bit of a unique call in the fact that a lot of times they may not really be able to tell us what is going on. So I think the ability to connect with children, to be able to adapt, whether it's your history or physical exam skills to the situation, whether that's, I may be seeing a newborn 1 minute and then the next minute may be seeing an adolescent. So it really does take a lot of adaptation, even from 1 minute to the next. And then obviously in a lot of aspects of medicine, we deal with families and caregivers and things like that. I think dealing with parents and caregivers, again, is a little bit of a unique aspect of pediatrics, just being able to connect and, work toward a common goal for a child is something else that's unique to pediatrics. And one thing I see a lot in my fellow pediatricians is just that idea of being a physician advocate, so someone who, is really out there fighting for one particular patient, but then also looking at that bigger picture for the entire health and well-being, of all children in a community or, a state or even broader. So, it's a lot of a lot of different things, a lot of different diagnoses or just skills to kind of build that you get to use pretty frequently.
Yeah. And I'm curious, as a pediatrician, you have to work with a lot of patients that may not be able to articulate their symptoms. What strategies have you developed to help you diagnose?
Yeah, I think you really have to kind of be an astute clinician and diagnostician a lot of times, really relying on those physical exam skills that, for better or worse, we have a lot of more tests, whether that's, blood tests or images to rely on, but in pediatrics we really do have to rely a lot on our physical exam skills. And then again, just those history taking skills. Sometimes I find I may have to ask a caregiver several different times in several different ways to really get at the type of information or the information that I'm really looking for. And so I think just a lot of, education, a lot of communication with the parents, but then really, like I said, really kind of having those astute clinical skills and diagnostic skills with the exam, and then beyond, being able to put it all together. So kind of going back to that, reason a lot of us went into medicine is, kind of putting that mystery together and figuring out. So it can be pretty exciting, part of medicine.
Can you give us an example of what you meant by advocacy?
Yeah. So a lot of incredible work is being done in the field of pediatrics these days, looking at factors of health that go beyond what we may have traditionally considered health factors that we address, in a clinic or a hospital setting. So thinking about things that we now call adverse childhood experiences, so toxic stresses like abuse or neglect or household dysfunction or systemic environmental factors such as, poverty, racism, education, all of those types of things that go into keeping a child healthy. And so really looking at the child and their family from that perspective, and realizing that, what I do in clinic is really a fairly small fraction of what's involved to keep them healthy. So how can we affect systems on a larger scale to keep children healthy? One incident that we've been dealing a lot with here lately is they just implemented testing in our school system for lead in the water, and we've had about 36 schools come back testing positive for lead. So
Wow.
We've been working with our school system here, our health department, to help provide that education, how to avoid lead, what to do when children have been exposed, how we need to test. And so that really goes beyond, in clinic, I may, test one child for their blood lead level and see if that is, positive or negative. But being able to affect the behaviors and the community on a larger level by working with the school system and to help them strategize how to mitigate these effects and how to get testing done, and then doing a lot with the media and the community to provide education, and it's really been an eye-opening opportunity to allow us to educate parents that yes, lead in the water at schools is concerning, but it's much more likely for younger children, to be exposed to lead in the home through whether it's water or lead paint or dust or things like that. So that's been one recent example of a way that I've been able to kind of get involved on that advocacy level at a larger scale.
But nutrition is a big part, I'm sure, of your advocacy efforts as well, educating parents and whatnot about healthy food choices and things like that. I understand we have, I don't know if it's definite by definition it's an epidemic, but childhood obesity. Talk to us a little bit about that.
Yeah, I do think I think your word choice is probably correct. I do think we are in the midst of a childhood obesity epidemic, and probably here in Memphis we're probably at the belt buckle of that as far as that goes. So, right. Educating parents, advising them on how they can be healthy as far as their diet and exercise goes is a really big part of practice these days. And I think we're still learning a lot and still kind of crafting that message. A lot of the families that I see, I work in a urban inner city area, so we have a lot of food deserts in our community. So it's not just telling them, what to eat. It's how do they access those foods? How can they, with the foods that they do have access to them, how can they maximize the ability to eat healthy with what they have? Fortunately, our medical school has developed some classes to teach our providers in those areas, so that makes us much better equipped to be able to educate our families on how to cook healthy and how to do those things. So I think maybe we're starting to see a little bit of that tide begin to hopefully swell and maybe starting to see some improvement. But that can be a very, honestly can also be a very frustrating part of the practice because, like I said, a lot of our families just don't have the resources that they need. So that's another area for advocacy, but can definitely be, frustrating on that individual patient level because it can be very difficult for those families to change and to see an impact of, you feel like you put in a lot of time and effort and counseling in that, but it's something very difficult to change.
The sense that I have of it is that there is a growing groundswell of education and people starting to become aware of the harms created by processed food and, of course, a chronic health issue of childhood obesity and type 2 diabetes, that sort of thing. I'm very interested in your thoughts on vaccination and if that's an issue in your area. It's been a hot topic here in California for a while and somewhat controversial.
Yes. So we are definitely seeing more and more of it. I think just it's not as common necessarily in the patient population that I see in my practice, but just through being involved with state level things and having a lot of colleagues in some of the more suburban areas of our city and some other parts of our state, it's definitely, I think, becoming more and more of an issue. And it's another difficult issue. I think what we see is a lot of folks who really just don't want to believe in the science, just a lot of skepticism in the science that's out there. And so I think the caregivers and the patients who are really entrenched in that view can be really difficult to have meaningful conversations with those families. We see a lot of flu vaccine denial this time of year. So I think, a lot of that is just kind of crafting the message. We've done a lot of work in my practice on Gardasil, or the HPV vaccine, and working on ways to kind of standardize our messaging as far as what our, I'm in an academic practice, so I have resident and medical student trainees. And so how do we talk to our parents about these issues? What are some myths and some facts that we can use to work against that misinformation? And we've been pretty successful with that vaccine. The flu vaccine, probably not so much, but I've started to craft my message on that, kind of focusing on prevention of severe illness, prevention of death, rather than, prevention of the flu itself. But just vaccines in general, it is throughout Tennessee, and I know in your area of the world, becoming more and more of an issue. Fortunately, a lot of legislatures, including out in California, have really been very active on this. Mm-hmm. And so that's been really encouraging, I think, nationwide, to see so many pro-vaccine bills be brought forth. A lot of them led by pediatricians, so another great way to put that advocacy into action. So I think we're starting to see, especially with the recent measles outbreak, over the last year or two, I think we're starting to see maybe the tide shift there as well to more understanding and more acceptance, especially from that public health point of view.
For sure. And I know with social media, things can get convoluted so quickly and misinformation spreads like wildfire. It's scary.
Right. It is. I'm encouraged about what some of the social media platforms have done to prevent the spread of misinformation. I don't think enough has been done. But that is also, I think, been at least a little bit encouraging to see, some of the platforms for that type of misinformation begin to be limited.
Yeah, and I know Facebook did that too. Tell us a little bit more about this family resilience initiative.
Yeah, so that's a pretty exciting program that we started a little over a year and a half ago, and it was actually created specifically to address the issues of adverse childhood experiences that I mentioned earlier. So, like I said, I work in a urban inner city practice. Probably about 95% of my patients are on Medicaid. So we have a high risk, high needs population that we serve in our practice. So, and with all the knowledge and research that we are gaining on ACEs, Memphis is really a community that is primed for an intervention for adverse childhood experiences and toxic stress and things like that. So we actually borrowed a lot from a couple different programs out in California. We looked at and met with Dr. Nadine Burkaris, who's now the Surgeon General for California and is in many ways the thought leader on ACEs in the country. And also we looked at the work of Dr. Dana Long in California as well to build our program. And we have taken a two-pronged approach. So we are a little bit different in that we're trying to intervene in the lives of very young children. So our program serves patients in our clinic from 9 months of age to 5 years of age. And we are asking about adverse childhood experiences, and we're also asking about those social determinants of health. So some of the things that I mentioned earlier, things like food insecurity, transportation needs, housing needs, utilities, personal safety, things like that. So we have outreach coordinators who are embedded in our clinic who are asking our families these sensitive questions when they come in for their well child visits across those age ranges. And then based on the needs of the family, so if we identify any adverse childhood experiences or we identify any health-related social needs, we directly connect them with services. So if they have a social need, we work with the family for them to identify what their most pressing need is, and we do warm handoffs either within our system or with our community partners to work to meet those needs. And then if we identify any ACE, we offer the family mental health resources, which at its maximum is a psychologist that is embedded in our clinic, to also less intense programs that we may offer, that we may connect them with in the community. So it's a lot about relationship building. Our outreach coordinators are really incredible folks in their knowledge of resources, but also in their ability to connect with families and form those relationships. The other aspect of our program that's pretty unique is that it's not just a one-time interaction and handoff. Our outreach coordinators are fairly frequently following up with these families to check in on them, make sure their needs are being met, and then seeing how else we might be able to help them. So, really embedding this work in a medical setting. There's a lot of crosstalk and collaboration between our coordinators and our clinical staff as well, so that the providers know what's going on with these families and what interventions. And then if we identify other things, we may have them connected with our coordinators on the back end as well. But from the medical end, dealing a lot with growth and development and any trauma and any medical interventions that may be required, or mental health interventions that may be required. So we're about 18 months into that program. We've served at this point close to about 400 families, and we have also launched into a large research program around this as well, so that hopefully we can show that this is effective in mitigating and preventing future ACEs in the lives of these children, hopefully preventing some of the known health outcomes that are associated with early childhood ACEs, and then looking at the mental health and well-being of these families and caregivers as well, so that hopefully we can have a program that is replicable, scalable, and hopefully, funded by, healthcare organizations, or payers or governments or whoever, depending on the location. So it's some pretty exciting work. Like I said, California is one of the leaders worldwide in this, but Memphis definitely has a lot going on as well when it comes to addressing ACEs. So we're very fortunate, and we have a great team that's working on this.
Well, that's very commendable of you. I'm sure it's a Herculean task to get on top of that and make an impact, but I have no doubt that you are succeeding in that. In the time that we have left, for some of our listeners, if I were a medical student, why should I go into pediatrics?
Well, I think it's fun. I tell people that the great secret of pediatrics, especially primary care pediatrics, is a lot of my day is spent playing with happy, healthy babies, talking to elementary age kids about their favorite television shows or superheroes or what they're going to be when they grow up. Counseling our adolescents on their future plans, their athletic or musical or artistic endeavors. So it's really a lot of fun just to be able to connect with children and families, to follow them over time and see that progression and see them grow up and change and progress over time. But also the ability to really connect with families and have a positive impact on the lives of children in our next generation. So I think number one, it's fun. Most people in our field are pretty like-minded, and so I think it's a great group of people to work with. Have a lot of wonderful colleagues who share this mission, and see things in a similar way. And then, as I mentioned earlier, I think just that ability to not only be able to provide excellent preventive care and advocacy, but also when children are ill and need us, to be there and to be able to provide that high quality diagnostic and clinical care that they need to get them better and get them back on their feet and back to doing all the things that they should be doing. And so it's really rewarding. And I think as far as primary care goes, it's right there on the front lines, and it's being able to affect the lives of these children very early on to hopefully set them up for a lifetime of health and success. And so that's why I love my job. I love all the different aspects and all the different things that I get to do. I think being in academics, being able to train up and teach and lead our next generation of pediatricians, and then also being able to, fortunately because of our great health system that I'm in and the city that I'm in, just to really be able to do a lot in the community as well, and again in the community also feel like you're making an impact and making a difference.
Yeah, what inspiring words.
It's been terrific speaking with you today. It's I commend you for all of the work you're doing, and so it's really is inspirational. And I'm hoping we can get you back on again.
Well, certainly. Well, thank you all. Yes, it's been really wonderful, and I'd love to be back.
Awesome. Well, thanks a ton for. I know your time is super precious. We're looking forward to having you back.
Go Chiefs.
Yes, go Chiefs.
Okay, well, have a great rest of your day.
All right, y'all too.
Okay, bye.
Thanks a lot. Bye.
Thank you to all our listeners. If you'd like to be notified when new episodes air, make sure to hit that subscribe button. And thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you'd like to be a guest or for more information, go to www.pacificcompanies.com.